Hi everyone, welcome back to our channel Nursing Bharske. Today we will discuss about the most important 30 MCQ with the proper rationale. If you want to join our test paper for the lifetime, only 2,999 rupees, 2,999 if you want to join our test paper for lifetime, topic wise MCQ, test paper, daily MCQ practice and full structure wise MCQ. Contact this number in WhatsApp. You will get all information or any specific subject you want, they will provide each and everything. Let's start the MCQ. A patient is receiving continuous IV infusion of heparin. Which laboratory value is most important to monitor? Option A, APTT. Option B, PTINR. Option C, platelet count. Option D, bleeding time. The answer is option A, APTT, because heparin works by the potentiating antithrombin 3, primarily affecting the instinct pathway. Activated partial thromboplastin time. APTT full form is activated partial thromboplastin time, is the standard monitoring parameter to ensure the therapeutic level. The normal therapeutic level is, when it comes the therapeutic level it's 1.5 to 2.5 times control, 2.5 times more, 2.5 times, and minimize the bleeding rings. And PTINR used for the warfarin, platelet count monitors for the HIT, and bleeding time assess the platelet function. So the answer is option A. Next, a nurse finds a patient unresponsive, not breathing and without a pulse. What is the first action? Option A, give 2 rescue breaths. Option B, check for carotid pulse for 10 seconds. Option C, start chest compression immediately. Option D, activate emergency response system. The answer will be option C, start chest compression immediately, because give 2 rescuer is not appropriate. Check for carotid pulse for 10 seconds. Here already they told not breathing and without a pulse, already checked. So don't waste the time for checking the pulse. So start chest compression immediately. Current AHA, American Heart Association guideline, emphasize highly quality chest compression as the first steps for an unresponsive, pulseless apneic patient. Is the CAB, compression, airway and breathing. Prioritize compression to restore the coronary and cerebral perfusion. Activating emergency, activating emergency response should be done after 2 minutes. Response should done after 2 minutes or by a second rescuer simultaneously. So the answer will be option C, start the chest compression immediately. Next, which finding in a postpartum patient within 24 hours of the delivery requires immediate reporting. Option A, fundus at the umbilicus level. Option B, lochia rubra with the small clots. Option C, saturation of 1 perineal pad per hour. Option D, temperature of 37.8. The answer will be option C, saturation of 1 perineal pad per hour. It indicates abnormally heavy bleeding more than 500 ml, more than 500 ml in fast, in more than 500 ml in fast 24 hours, suggesting postpartum hemorrhage. A fundus at umbilicus is normal. A fundus is umbilicus is normal, and lochia rubra with small clots, expecting 1 to 3 days. Lochia rubra and the lochia rubra, lochia serosa 3 to 10, lochia rubra serosa, lochia rubra, lochia serosa, lochia and lochia alba 10 to 14 days. It's normal, and temperature 37.8 degree is also normal. So the answer will be option C, saturation of the perineal pad per hour. Next, a patient with a major burns develops hoarseness, stridor, and the carbonaceous sputum. What is the priority? Option A, administer IV morphine. Option B, prepare for intubation. Option C, apply silver sulfagenide bands. Option D, insert a foil catheter. The answer will be option B, prepare for the intubation, because hoarseness, stridor, and the carbonaceous sputum indicates the inhalation injury with the impending upper airway edema and obstruction. So the answer will be option B, prepare for intubation. Next, which ECG change is the most characteristic of the hyperkalemia? Option A, prolonged PR interval. Option B, tall peak T wave. Option C, ST segment elevation. Option D, presence of U wave. The answer will be option B, tall peaked T wave, because tall peaked narrow based T waves are the earliest and most characteristic ECG sign of hyperkalemia, but is not most characteristic. ST elevation suggestion that injury. U wave hypokalemia. So the answer is option B, tall T wave. Next, a patient is prescribed digoxin and furosemide. Which electrolyte imbalance increases risk of digoxin toxicity? Option A, hypernatremia. Option B, hypokalemia. Option C, hypercalcemia. Option D, hypomagnesemia. The answer is option D, hypomagnesemia, both B and D, and hypokalemia, because furosemide is a loop diuretic that causes the renal loss of potassium and magnesium. Hypokalemia and hypomagnesemia increase the myocardial sensitivity to digoxin, potentiating toxicity like arrhythmias, nausea, yellow vision. So the answer will be option D. Both B and D, hypokalemia and the hypomagnesemia. Next, a nurse is suctioning a tracheostomy tube. Each pass of the catheter should not exist how many seconds? Option A 5 seconds, option B 10 seconds, option C 15 seconds, option D 20 seconds. The answer will be option B, not more than 10 seconds. When you are doing the suctioning in the tracheostomy, not more than 10 seconds. The pressure will be adult 120 to 150 mm of Hg. Suction when withdrawing. So the answer will be option B. Next, which finding in a patient with a chest tube indicates an air leak? Option A, continuous bubbling in the water seal chamber. Option B, intermittent bubbling in the suction chamber. Option C, tidling in the water seal chamber. Option D, serosanguous drainage in the collection chamber. The answer will be option A. Continuous bubbling in the water seal chamber, it indicates the air leak from the pleural space or the tubing system. Either the pleural space or the tubing system. Examples, it can loses the connection. Intermittent bubbling in the suction chamber is normal with the suction applied, and tidling is a normal respiratory variation, and drainage is expected. So the answer will be option A. Next, a patient with diabetic ketoacidosis has an arterial blood gas pH 7.25, PaCO2 30 mm of Hg, HCO3 bicarbonate 14 MQ per liter. Normal is 22 to 27 and normal PCO2 is 35 to 45. What is the primary disorder? So option A, metabolic acidosis with the respiratory acidosis. Option B, metabolic acidosis with the respiratory alkalosis compensation. Option C, respiratory acidosis with the metabolic compensation. Option D, mixed metabolic and respiratory alkalosis. The answer will be option B, because here the PaCO2 is not normal, and also the bicarbonate HCO3 also not normal, it decreases, and the PaCO2 also decreases. So metabolic acidosis, here the bicarbonate value is more lower than the PaCO2. So the answer will be option B, metabolic acidosis with the respiratory alkalosis compensation. So the answer will be option B. Next, which position is most appropriate for patient recovering from the lumbar puncture? Option A, supine with head elevated 30 degree. Option B, pond position. Option C, flat supine or sideline without pillow. Option D, Trendelenburg position. The answer is option C, flat supine or sideline without pillow 4 to 6 hours for lumbar puncture to reduce the cerebrospinal fluid CSF leakage from the dural puncture side, preventing the post-dural puncture headache. Most common side effect is headache. So we have to prevent the headache. For preventing this, we have to provide 4 to 6 hours of the flat or supine position or side lying without pillow. So the answer will be option C. And if we will do the head elevated in 30 degrees, what will happen? The CSF pressure will increases and the headache risk will be increases. So we are not giving the supine with the head elevated 30 degrees. Next, a 68 years old male on vancomycin develops flushing, rash and the hypotension rapidly. After infusion start, what is the most likely causes? Option A, anaphylactic reaction to vancomycin. Option B, Redman syndrome. Option C, Stevens-Jones syndrome. Option D, serum sickness. The answer will be option B, Redman syndrome, because Redman syndrome is the histamine release reaction. Histamine release reaction, not true in IgE anaphylaxis from the rapid vancomycin use causing the flushing, pruritus and the erythema, especially in the upper body and hypotension. What we have to do? We have to slowing the infusion. We have to do what to do? Slowing the infusion. Slow the infusion. Then pre-medicating with antihistamines. Antihistamine prevents it. So the answer will be option B, Redman syndrome. Next, which cranial nerve is assessed by the asking the patient to shrug shoulders against the resistance? Option A, cranial vagus nerve. Option B, spinal accessory. Option C, hypoglossal. Option D, glossopharyngeal. The answer will be option B, spinal accessory or the cranial nerve 11. It innervates the sternocleidomastoid and the trapezius muscle. Shrugging shoulders test the trapezius function, turning the head against the resistant test. So the answer will be option B. Next, a patient with a head injury has Glasgow Coma Scale GCS score is 7. How should the nurse interpret this? Mild brain injury. Option B, moderate brain injury. Option C, severe brain injury. Option D, normal neurological status. The answer is option C, severe brain injury, because normal GCS is 13 to 15, mild is 9 to 12 and moderate is mild, moderate is 9 to 12 and severe is 3 to 8. A score of 7 indicates that it's severe condition. It should be requires immediate intubation for airway protection and the intensive monitoring. It indicates also the traumatic brain injury with the coma. So the answer will be option C, severe brain injury. Next, which finding in a patient with a cast on the lower leg requires immediate notification of the provider? Option A, mild edema of toes. Option B, capillary refills less than 3 seconds. Option C, patient reports pin and needle sensation in the toes. Option D, ability to wiggle all toes. The answer will be option C. Patients reports pins and needles sensation in the toes because it's caused the paresthesia, pins and needle sensation. It indicates the what it indicates. It indicates compartment syndrome. It indicates the compartment syndrome. So the answer will be option C. Patient reports pin and needles sensation in the toes. Next, a nurse is preparing to administer a blood transfusion. While which IV fluid is compatible to prime the tubing? Option A, 5% dextrose in the water. Option B, lactated drinkers solution. Option C, 0.9% normal saline. Option D, 0.45% normal saline. The answer will be option C, 0.9% normal saline, because only normal saline is the compatible with the blood products. Dextrose solution cause the hemolysis and the clumping. Lactated drinkers contain the calcium, which can activate the clotting and cause the microaggregates, and the hypotonic solution can cause the red cell lysis. So the answer will be option C, normal saline. Thank you everyone. Please like, share and subscribe our channel, or if you want to test paper, please contact with this number in WhatsApp. You will get each and every information, or if you have problem in any subject, you will get subject wise or the topic wise test paper or the questions. Thank you everyone.